Well, we're on the last stretch of the day, and I'm so appreciative of our next speaker for agreeing to wrap us up and help us to really focus back on what our call is as a state and what our mission is. Nancy Galvagni is president of the Kentucky Hospital Association. As president, she's responsible for the effective operation and direction of all activities of the association. She leads the organization in its activities regarding the development of public policy related to health care, advocating on behalf of its members, and furthering the mission of the association to improve the health status of the citizens of the Commonwealth. Ms. Galvagni is a graduate of the Pennsylvania State University and has been employed by KHA for over 40 years, serving in a variety of management, policy, and advocacy roles during her tenure. Thank you, Nancy.
Well, thank you so much for the invitation to present again. It's interesting being the last speaker, but I would want to congratulate you. This has been a wonderful conference, and I've only been here in the afternoon, but certainly the theme is out there, and partnership, I think, is how we're going to get the job done. And interesting being the last speaker, but I'm going to end on a high note because I have some really good information to present because it shows that our efforts are paying off, and we're actually seeing an improvement in our hospital workforce. So that is very exciting. Of course, I need to figure out how to work the clicker. So just kind of as a reminder to everyone in terms of our hospitals in Kentucky, we do have 130 hospitals. 97 are acute care or critical access, and a critical access hospital is an acute care hospital. They're just small and rural with less than 25 beds. And as Senator Meredith mentioned, we're a rural state. Most of our hospitals are in the rural area, and 70% of our hospitals are what we call a sole community hospital. They're the only hospital within their county. Our hospitals are huge employers. We employ over 84,000 full and part-time individuals in the state, and we pay more than $6 billion annually in wages. So lots of times when we go out and we're talking to community groups, the hospital is either the largest employer or maybe the second largest employer after the school system. Because of the high wages that we pay, these are very good jobs in the hospital. The taxes that the hospitals pay, the employees pay, that generates a lot of economic opportunity. And basically, it's a $14 billion economic return to our state. And what Jim Musser, our VP for Government Relations, tells the legislators all the time is that we employ more people and we deliver more benefits to the state than our two signature industries, bourbon and horses. And you may not go to a horse race, you may not drink bourbon, but you will probably need a hospital at some point in your lifetime. So hospitals are very critical, and I think some of the individuals talked earlier about the importance of having the healthcare workers, because if you don't have healthcare workers, your other businesses aren't going to be healthy either. So moving on to the good news. The good news is that in total hospital workforce, and this is non-physician workforce, there are fewer vacancies this year than there were last year, and we are seeing particular improvement in our rural areas. So when we look at all hospital employees, there were 4,150 fewer FTE vacancies in 2023, which is the most recent year of our data, compared to 2022. And you can see the vacancy rate went down from 19% in 2022 to 12%. So that's a huge improvement. And again, when we look at the difference between urban and rural hospitals, we see that there was a lower vacancy rate in rural hospitals. And that's very true when I'm out talking to my members. We're also, seeing improvement in the nursing workforce. And so in 2023, there were 853 fewer RN vacancies compared to 2022. And we can see that vacancy rate is now just 16.5%, but it was over 20% before. And so, we're moving in the right direction. What it says to me is that, the things that we're doing are starting to pay off. Now, we still have critical needs. We're not doing a total victory lap here and saying that we're out of the woods. This is certainly a high vacancy rate, and in specific areas. And those top 5 areas haven't changed. They've moved around a little, which area is worse, but, it's psych and med-surg vacancies are the worst, with nearly 1 in 4 positions vacant. And so that's critical when you think about medical surgical. That's the mainstay of your hospital. We also look at ages and who is the workforce in the hospitals. And interestingly, the baby boomers have retired by now. Only 10% of our workforce in the hospitals are made up of the baby boomers. Who's making up our workforce are the younger. It's the Gen Z, and they account for nearly 1/4 of the RN workforce. And so that's one of the things that is changing with our hospitals, is that they're having to think about even, how to do flexible scheduling because it's younger workers, how to, have people pick up extra shifts and go out and pick what works for them. And they're starting to talk about how can they redo their benefit structure to be more appealing to that younger workforce. What is concerning when we look at who is next to retire, and those are people that are aged 55 and older, they end up being mostly in psychiatric and work in OR PACU, which also, from the previous slide, was some of the areas where we also have high vacancy rates. So that's a concern, is that they're likely to retire, but that's where we have a lot of the shortages. So these slides are very interesting. Of course, what I gave you was statewide data, but again, we do see regional differences. It's very different across the state. And on these maps, and the most current data on this one is on the left, in green being the best, that's vacancy below 10%. Dark blue would be very bad. But what this is showing, if the top map is looking at overall employee vacancies, and so the key is 2022 is to the right, and you can just kind of see how as the colors changed. We're seeing a lot more area development districts in green that are on the left, so that's good, below 10%, and the statewide average being 12% again. And so the most of the rural areas are green. Again, that when I'm out talking to the CEOs, they don't have as many vacancies. So when you look to the right, the shaded area, that was 2022, and you can see that we have more, again, areas green this year compared to last year. And there's still, even this year, 5 area development districts above the state average of total vacancy rates, and that is Buffalo Trace, the Bluegrass, Kipta, Lake Cumberland, and Kentucky River. Now, when we look at the bottom maps, that reflects the RN vacancy rates. And so the one on the right, again, is 2022, and you can see a lot of areas in blue. We even had some really dark blue, which was above a 30% vacancy rate. And this year, when we look to the map on the left, there's only 1 area development district in blue above a 20% vacancy rate. Now, some of the area development districts have moved around. In 2023, you had the Purchase, Lincoln Trail, and Gateway area development districts are good, below 10%. But they were different in 2022, so, there's some movement there. But I think the key takeaway is that the area development districts in blue have improved. You can see color coding, blue to orange to green, that's the way you want to go. And so when we look at actual rates, there's only 4 area development districts above the state average in nursing vacancy rates, and there's some of the same area development districts that are having trouble with all personnel, and that's Buffalo Trace, Kipta, Bluegrass, and Big Sandy. The metro areas, which I guess that's Kipta and Bluegrass, that's Louisville and Lexington, they are among the highest overall employee and RN vacancy rates. Now, you'll see a little different story when we go to the next one. We're going to look at turnover. Turnover gets at retention. And so the very first year we started working on the pipeline, and hair on fire and COVID and, we're dying here. We were focused a lot on the vacancies and getting people into the pipeline. And then really the focus switched into retention. And that's what hospitals have been working very hard is we have to retain the workers that we have. We need to build the pipeline, but we've got to keep the workers that we have. And so a lot of effort put on turnover and retention. And so these maps also show a large improvement for overall employees as well as for nurses around turnover. And again, it shows that those actions that we're doing, and we hadn't seen some movement. We've been tracking this for 3 years, and it was kind of disappointing. We weren't seeing any improvement last year from the prior year, but now we're seeing it. So it takes time for some of those new policies and programs to see the results. But when we start with overall employee turnover, again, that's the top map, the rate was reduced from 24% in 2022 down to about 21% in 2023. And most areas obviously exceeded the state average, like the whole state was in blue, so not looking great. But in 2023, there's 9 ads in blue, so still not where we want it to see, but again, trending in the right direction. Notably, the Green River and the KIPTA area had the lowest turnover rates in the state of overall employees. Now remember, KIPTA was high in overall vacancies. So while they have a lot of vacancies, they're doing better in retaining their workforce. We kind of saw the same trend with RN turnover, which is the bottom. And that turnover rate was nearly 20% in 2022. It's down to 16% in 2023. And there were only 3 area development districts above 20% in 2023 compared to 10 in 2022. So we still had 9 areas with turnover rates above the state average. And we have the top ones noted on the slide here. But the Barren River RN turnover was below 10%, followed again by the Louisville area, KIPTA, with the second lowest turnover. Again, they had high vacancies, but they're doing a really good job. The hospitals in that area are doing a really good job with retention, as shown here. This is, we measure more than just RNs. There's lots of other positions, as JP has said, in the hospitals. This is looking, you can see positions here as well as the vacancy rates. This is for 2023. And of course, the highest shortage areas in FTE positions are with imaging, lab, behavioral health, and pharmacy and respiratory therapy. Now, when we look at the trends, what we're seeing is that we're seeing a worsening for imaging techs. Their numbers are going up. It's increased by more than 100 FTE vacancies since 2021 and 2022 when it was about the same. The lab vacancies are rising also compared to 2022, as are pharmacy vacancies, but respiratory therapy seems to maybe have stabilized. We started surveying for mental health techs. That was a new category for us this year, and it has a very high vacancy rate, and those are people that help in our psych hospitals and our hospitals that have psychiatric units. And these are, again, just the shortages in hospitals. As JP said, these are small numbers, and that raises a question. If you have 300 people that you're short, how do you train 300 people when they're spread across the state, the vacancy rates? But again, we don't know from long-term care, maybe from other settings, what those shortages are. So I've talked a little bit about retention. This has been a huge focal point for our hospitals. So, and part of retention is that our hospitals have really put money in to raise the wages of our workers in our hospitals. And so we have a report done for us every year by an outside consultant, Kaufman Hall, that looks at the financial condition of our hospitals. And one of the things that they shared with us is that Kentucky hospitals have experienced a significant 5% increase in salary expense, far more than the national median of all hospitals across the country. So we have put more focus in our state on raising the wages of our workers. And that's why when I'm out talking to CEOs, they're talking about now we still have contract labor, but not nearly to what it was before. And there are some hospitals that have been able to eliminate it because they've raised the wages of their workers. The other thing that we have focused on around retention is providing a safe work environment. And workplace violence is a very real issue. It's something concerning. It does go to retention. You can't be afraid to go to work. So one of the things that our members and KHA worked on, and we had the help of Representative Kim Moser, was our bill sponsor, and Senator Meredith and Senator Douglas, they all helped with this, was to pass a statute earlier this year to make assault against a healthcare worker a felony. And, Whether that'll help or not, hopefully it's a deterrent. And we kind of didn't know how this bill was going to be received. We thought, are people going to have pushback? We had so much support for this. We went in and really made it in the hospital. We wanted to protect everyone. And we had legislators say, well, we need to expand this to doctors' offices and clinics and other places. So because violence just doesn't happen in the hospital. So you can see it's in a lot of different areas there. We have been also providing training because de-escalation is important, right? You can't just go sue people, but you hope that you can de-escalate the situation. So we have partnered with an outside consulting firm, and we have provided free training to our hospitals to come in and teach all sorts of different professionals within the hospital de-escalation and workplace violence prevention, and that's been very helpful. And so we've developed a lot of resources on our website, again, to help with improving the overall work environment. We continue to help our members implement this new workplace violence law. We're rolling out some new signage in the hospitals. A lot of hospitals have signs, not all do, but we want to make sure that, people come in and they realize, hopefully, we expect you to act, in accordance with how you should. And oh, by the way, if you don't, it's a felony if you don't. So we're providing that signage to our hospitals, helping provide some other templates that hospitals could use to educate patients, educate people coming into the hospital, and then also partnering with statewide organizations and asking our hospitals to partner at the local level with law enforcement, because it's important that, if you do have an incident, that police are going to work with the hospital. They're going to come in and help with that. And, those relationships are very different. In some areas, they have a great working relationship with the police, and others not so much. And sometimes police are called and they don't do anything. So it's important for us to educate law enforcement, prosecutors about the law. Sometimes we've heard police come to a hospital and they think because it's a hospital you can't arrest anyone. Well, no, this has changed. And we're talking about, physical assault where it's not, verbal abuse can certainly be workplace violence, but we're really talking about people being assaulted, and it's kind of unbelievable. So, we're excited about this, and as are the staff of the hospitals. As I've been out meeting with the hospitals, they will tell me about how much their staff appreciates that we are working on creating a better workplace for them. JP talked about also the excellent partnership that we have with the Kentucky Chamber through the Talent Pipeline Management Program, and we have regional representatives out taking our data, working with our hospitals, trying to make those connections at the local level. JP already said you can go on our website and find that project asset list. I'll show you a picture of that in a minute. We're very proud of that. One of the things our board told us last year was just do an inventory, who's doing what and how can we share these best practices across the state. So we really focused on that last year. And I think to recognize the quality of the program, I'm really proud that we just recently won an award. We were inducted into the U.S. Chamber Talent Pipeline Management Hall of Fame, and this has been a very new program for us, so I think that goes to just the partnerships and the great work that we have been doing through this program. So this is what this project asset list looks like. You can go on, on our website, anybody can look at this. You can click on within certain regions. If you are in West Kentucky and you want to see what's going on in West Kentucky, you can look there, or you can pull it up and you can search by the type of program and really see who's doing what. And then rather than call the person at the program or the hospital, it refers you back to our Talent Pipeline Management regional person that can give more information on these different resources and best practices. So some of the other things that we are working on, we have been working on creating a different method to educate LPNs. We know that in some states, LPN training can actually occur in high school, and so that's been very successful in some other states. So we are trying to develop a pilot program to create that LPN training program in high school through KCTCS. We're talking a lot with our different education partners on how to address specific issues, and particularly these allied health issues. We are also trying to build the pipeline, we haven't forgotten about that, to get more students interested in health careers. And one of the things that we're working on this year is creating some marketing materials that will, be considered cool. How to make healthcare cool again is sort of our theme here. What's going to make young people interested. And I think, to what JP was saying before, if people just think the only folks that work in a hospital are doctors and nurses, we need to get the word out about all the different professions in hospitals and the great pay and that you can have from this. And then also, that a lot of this, you can get your education paid for. And I don't think a lot of people understand that when you're in a high-demand career, there's a lot of resources out there, work-ready scholarships, hospitals have scholarships, Hospital 200, but sometimes it's hard to, if you're the student, to figure out how you're going to pay for things. And so one of the things that we're working on this year is creating a website that's going to hopefully maybe be a one-stop shop for students, that if you are interested in a health career, what are all the funding sources, and hopefully you can get that tuition paid for and not have to be in debt. I'll put a plug in for we're going to have a workforce summit, and so would love to have you participate in that. And JP's heading that up, doing a wonderful job, and that is coming up shortly, as you can see, November 12th. Would love to have folks join us. There are a lot of resources on our KHA website. A lot of the data that I've talked about today, those reports are all available on our website, in addition to the nurse workforce projection report that JP talked about earlier. That is on our website as well. So feel free to take advantage of that. And I guess I'm going to wrap up now and just say that I've appreciated so much KHA being asked to be part of this, and I think just the partnerships is what gets the job done. And CPE, thank you so much. You're doing a great job leading this effort. Thank you.